Hello, this is the Iredell County Community Health Project for the University of North Carolina at Wilmington School of Nursing Population and Community Health Nursing Program, Spring 2023. The purpose of this presentation is to identify, assess, and create interventions to help a vulnerable population in Iredell County. We chose as our vulnerable population in Iredell County the people of African American descent. This population makes up 12.5% of the overall population. In Iredell County, this group faces more health issues, poverty, and education disparities than the overall population. The two main health issues that face this population in Iredell County include infant death and heart disease. African American infants are 3 times more likely to die prior to their first birthday than the Caucasian infants. African American women are less likely to receive early prenatal care than their Caucasian counterparts. African American mothers are more likely to experience poverty, smoke during their pregnancy, and have an overall low educational attainment in comparison to other Caucasian residents. African American mothers are nearly 10% more likely to become overweight or obese prior to becoming pregnant. And when surveyed, 32% of community respondents believed that heart disease is a top health concern. African Americans in Iredell County face a significant healthcare disparity. Approximately 25.7% of African American families live below the poverty line, which makes it difficult to afford basic needs, leaving healthcare on the back burner. In comparison, more African Americans live below the poverty line than any other race in Iredell County, and twice as many African Americans live in poverty per capita than their Caucasian counterparts. As part of this project, we interviewed a public health supervisor named Mary Davis. From this interview, she expressed that her experience is that there's a large disparity between the health care that African Americans receive compared to others. Of note, she stated that there was a significant lack in preventative health care and healthcare literacy. Ms. Davis further noted that this population has an increased rate of teenage pregnancy, unhealthy mothers, and an overall distrust in the healthcare system. Ms. Davis also stated that due to unequal healthcare access, this population faces increased rates of high blood pressure, cholesterol, diabetes, and obesity. These issues have an increased risk of heart disease and high-risk pregnancies. From our review of the community health of Iredell County, morbidity and mortality rates are relatively high, resulting in an overall health status of fair to poor. In the county, there are a variety of health services available, including local hospitals, a public health department, and low or no-cost health insurance programs. In the data, we found that Iredell County faces chronic diseases, poverty, health and education disparities, and is facing a significantly high infant death rate. To address these issues, we recommend increasing healthcare options for those who cannot afford it, increase healthcare education services, along with addressing medical response times, violent crime, in impoverished neighborhoods. As part of this project, we also interviewed Becky Wagner, who's a VP of Nursing and Patient Services. This interview was conducted over the phone and was brief. During this interview, Becky Wagner was asked what she felt were the 2 health concerns in the county. She responded, saying that she sees the most illness being caused by unhealthy eating, which is leading to obesity, heart disease, high blood pressure, and many more. When asked what would help the community most in healthcare, she said that, like most areas, better access is key. And when she asked about what she would attribute the cause of these health concerns to, she stated lower incomes, lack of education, and lack of preventative care. Here we're going to explore the 2 major health issues we found with Iredell County: heart disease and infant death. As part of this project, we also conducted a windshield survey of the area, specifically Statesville. From that data and data we were able to find from sources, we were able to identify community strengths and weaknesses. The community strengths are easily accessible public transportation. The ICATS transportation system serves human service customers and the general public. It operates as a ride-share system and has specific routes and schedules to be structured to transport multiple passengers to multiple destinations. The services are provided through deviated fixed routes, subscription routes, and demand response service trips. There's also multiple resources for healthcare access. Iredell County has a good amount of hospitals and healthcare facilities. There are 2 big hospitals, Davis Regional Medical Center and hospital is part of the Iredell Health System. There's also several clinics that are easily available. Another community strength is a high percentage of high school graduates. According to the United States Census Bureau, from 2017 to 2021, 91.1% of persons aged 25 and higher are high school graduates, and 31.6% hold a bachelor's degree or higher. Also from this data, we were able to identify community weaknesses, which include a high crime rate of 49 per 1,000 residents. Statesville has one of the highest crime rates in America compared to all communities of all sizes, from the smallest towns to the very largest cities. A person's chance of becoming a victim of either a violent or property crime here is 1 in 20. With a population of 28,844, Statesville has a combined rate of violent and property crime that is very high compared to other places in similar population size. 18.7% of Statesville, North Carolina residents had an income below the poverty level in 2019, which was 27.2% greater than the poverty level of 13.6% that's across the entire state of North Carolina. 12.6% of people under the age of 65 years are uninsured, and the majority of these do not seek preventative health care. For community nursing diagnosis number 1, we found that African American populations are at risk for deficient knowledge related to heart disease, as evidenced by the high rate of cardiovascular disease, unhealthy lifestyles, and 18.1% death rate in Iredell County. The contributing factors to heart disease are obesity, hypertension, diabetes, and high cholesterol. In Iredell County, cardiovascular disease leads to 18.1% of all deaths. 35% of the population in Iredell County has high blood pressure, and 32% has high cholesterol. As interventions to this community nursing diagnosis, we need to educate the vulnerable population on the risk factors for heart disease and the disease process. They should be educated on maintaining a healthy lifestyle by incorporating healthy diet, regular exercise, avoiding smoking and alcohol. The secondary prevention includes early screenings for diabetes prevention classes and nutrition programs for those at high risk. In tertiary intervention aims to reduce the severity of the disease and improve quality of life. Nurses will monitor compliance to recommendations and prescriptions, and we will insist that patients follow up frequently with doctors to manage their disease. Our community nursing diagnosis number 2 is that African American infants are at risk for death related to lack of prenatal care, teenage pregnancy, and low birth weight, as evidenced by the infant mortality rate of 8.5%. The contributing factors to infant death include high-risk pregnancies, increased teen pregnancies, the inability to access health care, no preventative or prenatal care, low health care literacy, or being overweight or obese. According to this study by Partridge, inadequate prenatal care utilization recorded 11.12% of expectant mothers, more commonly among women over 20 years of age, Black, non-Hispanic, and Hispanic women, and those without high school education. Relative to adequate care, inadequate care was also associated with increased risk of prematurity, stillbirth, early neonatal death, late neonatal death, and infant death. In Statesville, there was a high rate of teenage pregnancy. Teenagers hide their pregnancy, do not get the necessary prenatal care, and also do not have a family support. This leads to unhealthy pregnancy, infant being underweight, and born with health issues. In Iredell County, African Americans are 3 times as likely to not make it to their first birthday as their white counterparts. The African American infant mortality rate in Iredell County is nearly double that of African Americans in North Carolina overall. The overall infant mortality rate for Iredell County is 8.5%, increasing from 7.3% in 2014. Iredell County's infant mortality rate is higher than that of North Carolina, remaining that way for nearly a decade. As interventions to this community nursing diagnosis, we found that adolescents and teenagers should be provided with education on safe sex and use of contraception. Sex education should be given at school, and parents should also open up to talk to their kids about it. They should also be given education on prenatal care if necessary. Education should be given about healthy weight and encourage people to continue that education. Secondary intervention includes identifying the risk groups and providing them with resources. Contraception should be easily made available. Pregnancy toolkits should also be easy to access. Pregnant teenagers should be given support, and prenatal care like prenatal vitamins and prenatal checkups should be available to everyone. Community health workers should also screen for the ability to access health care. And tertiary prevention involves keeping the patient compliant with recommendations and prescriptions. Community health nurses should make sure the patients are taking their prenatal vitamins, having regular prenatal checkups, and is compliant with the health care plan. In conclusion, Iredell County needs to address issues pertaining to the vulnerable population of African Americans within its borders. This includes access to health care, prenatal care, and sex education and teenage pregnancy. This project has changed our nursing practice to consider the largest negative effects of community on vulnerable populations. Also, this has exposed the need to address community failings in actionable and real ways.